Alright guys, welcome to the fourth video of USMLE in less than 10 minute series. In the last three videos we talked about the pancreas, and now we're going to move on to the biliary tract. The first topic we're going to cover is cholelithiasis, or simply known as gallstones. To truly understand gallstones, we have to understand the anatomy of the biliary system. It's quite simple. You just have to understand the pathway of how bile moves from the liver to the gallbladder and to the duodenum. So in the liver, where bile is produced, we have the right intrahepatic duct and the left intrahepatic duct. These ducts combine to form the common hepatic duct. When the bile goes to the gallbladder, it's stored there, and when it's released into the cystic duct, which combines with the common hepatic duct to form the common bile duct. And finally, the common bile duct combines with the pancreatic duct from the pancreas to empty into the duodenum via the ampulla levator. So know the basic anatomy, and it'll take you a long way, and it's kind of high yield. So bile is produced by the liver, we know that, and from the liver it's stored and it's concentrated in the gallbladder. When we eat food, we have proteins, we have fats, and we have carbohydrates. The fats in our diet stimulate the release of cholecystokinin from eye cells in the duodenum, and the job of CCK, or cholecystokinin, is to go to the gallbladder and cause its contraction. So in response to fats, CCK is released, and it causes contraction of the gallbladder and bile to be released. So that's how bile is released. So now, how do gallstones form? So gallstones, or cholelithiasis, is when a stone precipitates in one of the ducts. To understand the pathophysiology, there's two underlying concepts that you have to understand. In order for stone formation, there has to be two factors present. One is imbalance in the content of the bile, and number two is biliary stasis. When we talk about imbalance, bile is made of many substances. These substances include bilirubin, cholesterol, calcium carbonate, and bile salts. When there's an increase in bilirubin concentration or cholesterol or calcium carbonate concentration in comparison to bile salt concentration, the precipitation of the stone is greater. There's a higher chance that the stone is going to precipitate. Bilirubin, cholesterol, and calcium carbonate are all hydrophobic substances. That's why they tend to favor precipitation of the stone. On the other hand, bile salts are hydrophilic, so they tend to favor no precipitation. On the other hand, biliary stasis is when there's impaired gallbladder emptying and motility. So, if the bile doesn't move, if it just stays there, there's impaired stasis. It just kind of stays there and there's no contraction, there's no movement, it's going to precipitate. Some things that can impair the motility include NPO, which means nothing per os. So when a patient can't take anything orally, cholecystokinin is never triggered and the gallbladder never contracts, promoting the stasis. TPN, total parenteral nutrition, is also where we feed the patient through IV and the patient isn't taking anything through mouth, so there's no stimulus for CCK release and therefore stasis. And then pregnancy increases progesterone, which decreases motility. So imbalance and biliary stasis are important to understand because they're the two fundamental underlying factors that promote the precipitation of stone. So we have different types of stones. We have cholesterol stones, which are the most common. In 90% of cases, patients are going to have cholesterol stones. We have black pigment and we have brown pigment. So cholesterol stones are usually going to be due to obesity, because obesity increases the synthesis of cholesterol, female sex, and multiparity, because estrogen is known to increase the synthesis of cholesterol, and progesterone exposure, of course, decreases the motility like we talked about in the last slide. So remember, like I said, there's two underlying factors. One is the contents. So if cholesterol is one of the contents that promotes the precipitation of stone. So all these factors listed over here, like obesity, female sex, Crohn's disease, they all increase cholesterol synthesis in comparison to bile salts. And that's what promotes the gallstone formation. Age greater than 40 is very important. Crohn's disease, it affects the small intestine, like the distal ileum. The distal ileum is involved in reabsorption of bile salts. So if we can't absorb bile salts, their concentration decreases in the bile, and the cholesterol concentration increases in comparison, which causes the gallstone formation. And of course, rapid weight loss. If you have rapid weight loss, you're breaking down fat, and the fat is turned into cholesterol. Black pigment stones are due to an increase in bilirubin concentration in the bile. So hemolysis, like sickle cell disease, states where there's chronic hemolysis in the blood. So there's increased release of unconjugated bilirubin, which is stored in RBCs. This unconjugated bilirubin goes to the liver, and it exceeds the liver's capacity to conjugate it. So the unconjugated bilirubin concentration increases in the bile, promoting the formation of a stone. Cirrhosis affects the liver, causes liver failure, so we're going to have decreased ability of the liver to conjugate bilirubin, once again increasing unconjugated bilirubin concentration. TPN I already explained. and of course age greater than 40. So brown pigment stones are very rare, but they can happen. They usually happen due to infection by a liver fluke known as cholelithiasis. Basically, this parasite synthesizes and releases beta-glucuronidase, and this beta-glucuronidase is an enzyme that hydrolyzes conjugated bilirubin into unconjugated bilirubin. So therefore, once again, as unconjugated bilirubin increases, it's a hydrophobic substance. It's going to cause gallstone formation. So you have to know all these risk factors and which ones cause which stones. For example, like obesity has increased chance of cholesterol stones. Okay, moving on, here's a picture. You can see this yellow stone over here is a cholesterol stone. That's what it looks like grossly. And these black greenish stones are pigment stones. This is a real gallbladder, and you can see there's many stones. So this patient must have had some chronic predisposition to gallstones. Symptoms and signs, I think everyone knows. The main symptom is going to be right upper quadrant pain. This pain is referred to as biliary colic. It's right upper quadrant pain radiating to the scapula, and it's worsened after eating due to release of cholecystokinin. So imagine if you have a stone stuck in the common bile duct, and you eat some fatty food. It causes the release of CCK. Now the CCK is going to cause the gallbladder to contract against an obstructed duct, and that's going to cause pain. The gallbladder is contracting, but the bile is not going anywhere because there's a stone in the ducts. That's what causes the pain. And it's important to remember that not all patients are going to be symptomatic. If the stone is not large enough to cause an obstruction, it's going to be asymptomatic and the stone might just pass. And another condition known as cholelithiasis is a gallstone in the common bile duct. So if you see a gallstone in a common bile duct, this is the terminology for it. So diagnosis, treatment, and complications. The diagnosis is made by a right upper quadrant ultrasound. Even though this is step 1, you should know, because this is very basic, that when you have right upper quadrant pain, you should do an ultrasound to look for gallstones. Some labs can also aid you if the gallstone is stuck in the common bile duct for a long enough time. It can cause the elevation of liver enzymes like AST and ALT, and of course GGT and ALP, which are found in the ducts. Treatments can be elective cholecystectomy, so if the symptoms are severe enough, we talk with the patient, and we go in and we remove the stone and or the gallbladder. Complications, in the last videos we talked about, include acute pancreatitis, cholecystitis, which is an infection, and ascending cholangitis, which we'll talk about in the next video. So finally, it's high yield to remember that the common bile duct is formed via the cystic and the common hepatic duct. CCK is released by eye cells of the duodenum. It causes contraction of the gallbladder. Postprandial biliary colic is due to release of CCK. There's the 4 Fs, a famous mnemonic used to remember the causes of gallstones. These include female, 40, fertile, and fat. They increase the risk, especially of cholesterol gallstones, and you should remember this liver fluke. It causes pigmented gallstones via release of beta-glucuronidase and hydrolysis of conjugated bilirubin. And patients with right upper quadrant pain, especially after meals, the next best step is a right upper quadrant ultrasound. Thank you guys. I hope you guys liked the video. I know that was quick, but it's very high yield, and make sure you guys remember, watch it over if you have to, and let me know what you guys want to watch next. Thank you.